First you see this video, it will help you in understanding this lecture. Assalamu alaikum. Today our topic is drug affecting on reproductive system. What is reproductive system? Reproductive system of an organism is also known as genital system. Is the biological system made up of all the anatomical organ which involves in sexual reproduction. Next, here is two parts of reproductive system. First is male reproductive system and the other is female reproductive system. Male reproductive system consists of prostate gland, seminal vesicles, penis, vas deferens, testes, scrotum, and urethra. And female reproductive system consists of fallopian tube, uterus, ovary, cervix, and vagina. Gonadotropin, releasing hormone, luteinizing hormone, follicle stimulating hormone, releasing hormone is a hypothalamic decapeptide stimulate of synthesis of both luteinizing hormone and follicle stimulating hormone within the anterior pituitary gland and their secretion into the blood. Hypothalamus secretes releasing hormone which secretes anterior pituitary, and anterior pituitary secretes luteinizing hormone and follicle stimulating hormone and so on. Luteinizing hormone secretes testosterone and follicle stimulating hormone secretes estrogen and anti-Mullerian hormone and progesterone. Next is male reproductive system. A male who has reached puberty will produce millions of sperm cells each day. Each sperm is extremely small, only 0.05 millimeters long. Sperm develop into the testicle within a small system of tiny tubes called the seminiferous tubules. A man produces sperm every day, but a full sperm regenerate cycle known as spermatogenesis and takes time to about 64 days. Next is female reproductive system. An egg is normally fertilized by a sperm cell in a fallopian tube within 9 days. Egg moves to the fallopian tube into the uterus. It then attaches to the wall of the uterus. After the fertilized human implants, the growing placenta start releasing human gonadotropin can be found into the blood before the first missed menstrual period. This can be early as 6 days after the egg implants. From 150 million spermatozoids, several thousands only reach the place of fertilization to fertilize the single egg. To the rest of them die. During sex, a man throws from 2 to 5 ml sperm into the vagina. From picture, you can see the process from ovulation to the implantation. First is ovulated, secondary oocytes, then day 0, and it forms fertilization, occur zygote, and then into fallopian tube. Go and in day 2, it forms 2 cells, and day 3 forms 4 cells, and day 4 morula form, and then the embryo occurring and blastocysts cyst implant 7 day. Next is the male and female reproduces for continuation of reproduction. Human reproduction is any form of sexual reproduction resulting in human fertilization. It typically involves sexual intercourse between a man and a woman. Here sperm and egg combine, then form zygote, and this process is mitosis, and it forms a fetus and then form infant. Next is drug affecting on male reproductive system. Classification is androgen, anabolic steroids, and penile erectile and dysfunction drugs. Generic name and brand name we will discuss next. First is androgen and danazole. Internal dose is capsule 5 mg, 10 mg, 100 mg, 200 mg. Half-life is 3 to 10 hours. Side effect: acne, weight gain, oily skin or hair, flushing, sweating, nervousness, acne, and flushing, vaginal dryness, burning, itching, or bleeding. Next is androgen. Internal dose is 158 mg, 198 mg, 237 mg, and half-life is 8 days. Side effect: acne, decrease in breast size, weight gain, oily skin or hair, flushing, nervousness, sweating, vaginal dryness, burning, itching, or bleeding. Next is anabolic steroids. Oxandrolone. Internal dose is tablet 2.5 to 10 mg, and half-life is 9.4 to 10.4 hours. Anabolic steroids have not been shown to enhance athletic ability. Patients treated with androgenic anabolic steroids may be an increased risk for the development of prostatic hypertrophy and prostatic carcinoma. Next is penile erectile dysfunction drugs, Viagra, and internal dose is 50 mg and half-life is 3 to 4 hours. May be taken anywhere from 30 minutes to 4 hours before sexual activity. Side effect is headache, dizziness, abdominal pain, blurred vision, and flushing, changes in color of vision, and so on. Next is drug affecting on female reproductive system. Classification is estrogen, progestin, fertility drugs, uterine motility drugs, oxytocin, abortifacients, and generic names and brand name we will discuss next. Contraceptives are the name given to the medicine and other devices that are used to prevent unwanted pregnancy. Contraceptives may also be referred as birth control. Hormonal contraceptives consist of one or more synthetic female sex hormones. Hormonal contraceptives that control both an estrogen and progestin are called combined oral contraceptives. Those that contain just progestin are called progestin only contraceptives, and in short form it known as POPS. Next is drospirenone and ethinyl estradiol. Internal dose is 3 milligram to 0.02 milligram and 3 milligram to 0.03 milligram. Half-life is 25 to 33 hours. Side effect is vomiting, bleeding, stomach cramps, vaginal bleeding, changes in menstrual periods, and mechanism of action is through the suppression of gonadotropin released from the hypothalamus. With suppression of gonadotropin, release ovarian stimulation and follicular maturation do not occur, and the estradiol levels are low due to the diminished follicular production. Next is levonorgestrel, levonorgestrel, and internal dose is 0.0509 per 0.2 mg, and half-life is 13 hours. Side effect: nausea, vomiting, headache, abdominal cramps, bloating, breast tenderness, swelling of the ankles, weight change and may occur. Next is Mirena levonorgestrel releasing intrauterine system is hormone releasing Mirena intrauterine device, the first and only hormone releasing as heavy menstrual bleeding and for up to 5 years in women who choose in intrauterine device for birth control, and is inserted into the blood by a healthcare provider using a special applicator. Short strings connected to the device extend beyond the cervix into the vaginal and allowed for device removal. Next, here's the prescription. You can write prescription. First is patient, then address and prescription box in medicine name and dose, and in the last signature and date. Here is the picture of this drug Viagra 50 milligram. Next is danazole capsules 50 milligram, and next is drospirenone and ethinyl estradiol 21 tablets each containing 3 milligram drospirenone and ethinyl estradiol 0.03 milligram, 7 inert white tablets. Next is levonorgestrel and ethinyl estradiol. Thank you. Goodbye.